Welcome. This is the UCGHI Global Health Institute's video series around food justice and health equity. And so I want to introduce our academic advisor, Dr. Carrie Waterman, and we have special guests here today talking to us from the CommuniCare Health Centers. Dr. Carrie, it's going to you.
Cheryl, thank you so much for the introduction, and thank you all for joining. It's really a pleasure to have all three people from the CommuniCare Health Center in Woodland, California today to talk to us about their project and their program. And I think I'm just going to turn it over. I do have some interview questions we'll go through, but Edye, maybe you can just start with a brief introduction so people can learn a little bit more about what we'll be discussing.
Sure. Thank you all for the introduction and for the opportunity to share with you more of what we're doing. I feel like a lot of the presentations so far have really focused on the food justice side, and we're all about that. But I would say that our work probably is a little more centered on the health equity component of what this group's about. We have a presentation that we would like to share with you all. And we've tried to incorporate as many of the questions as possible into it, but we also want this to be a dialogue. So please just ask questions as we go along. It may seem a little, it's Zoom, so the ease is always a little bit less than what I would prefer if we were in person. But we'll just, if it's okay with you, hit the road with our presentation. And I think we'll cover a lot of those aspects of the introduction and background as to what we're doing and why we're doing it when we do that. So it looks like I do have ability to share. So I will pull up our slides here. Can you all see that first slide? Food is medicine?
Yep.
Excellent.
Yes.
All right. So as Carrie mentioned, my name is Edye Kuyper. I'm the Food and Wellness Manager at CommuniCare Health Centers. We'll tell you a little bit more about what our organization is and what we do in a minute. Carrie gave me such a nice introduction. I really appreciate that on the message last night. And I will just mention, I grew up on a farm and was thinking a little bit about how that impacts my connection to food justice. The farm that I grew up on was very much not the type that any of us are representing in these calls. My dad was a veal farmer, and so I grew up within the CAFO setting and really saw a lot of the challenges of the food system, the industrial food system, and have spent I would say most of my career working in settings that I think are quite different from that, but also with that experience of what it's like to be an independent, struggling business person working in today's food system. So Brian, you want to quick introduce yourself too?
Sure. Hi, I'm Brian Boyce. I'm the garden coordinator and garden and outdoor education coordinator here at CommuniCare. And I've been an organic farmer since 1984. I've done very small, well, not this small scale, but kind of small scale market gardening, very large, 400 acre farms. But this project and this job enables me to both grow food and incorporate my interest in natural healthcare, which I've had, my whole adult life. So it's a great opportunity for me to serve people with food and herbs and all the education that I can provide, in addition to just the production of the food. Happy to be here today.
Hello, everyone. My name is Marina, and I am the food education coordinator. So I'm basically mostly do cooking classes for our patients. And because of COVID, I've just been doing, it was virtual first, and then we're just slowly going into in-person cooking classes. And I grew up in a border town, Calexico and Mexicali. And in Calexico, there was like a lot of agriculture, like that's like the main thing there. But it was really interesting that it was until like I left my town that I realized that I barely got into like agriculture or like gardening, and CommuniCare like really provided that opportunity for me to dive in more into gardening. And in my other job as well, we started like a community garden as well. But it's really interesting how I grew up in an agricultural town, but I never really got my hands on that, or even like the experience of having fresh foods like that, just because of like the corporate way of food is grown there. So yeah.
So we have a video that I'm going to have to get all technical and toggle my screens just a minute. I'm going to stop that first share and switch to this video. So it's just a quick little intro to our work, and sorry, bear with me. Okay, here we go. We did this video, in collaboration with a volunteer who
we can't see your screen.
I'm just about to share it. Give me just a minute. Okay, here we go.
Thanks for coming in.
Thank
It's so
you.
nice meeting you.
Nice to meet you too. Thank you.
All right, so that's our quick pictorial explanation of what we're up to. And now we're going to give you a little more background on, like I said, the what and the why. So let me switch my screens that I'm sharing, and we'll have Marina. Sorry, I'm feeling very technically challenged this morning.
No worries. That was beautiful. So the
Thank
food,
you.
the farming component is co-located literally at the health center.
Exactly.
I
Yeah.
read that, I know, but when I see it like that, it's super cool. Wow.
All right. So Marina is going to walk us through a couple slides here about why we're doing what we're doing.
Yes, thank you, Edye. So why food in the clinical space? Just like Rich said before, like I don't think there's a lot of like gardens or food being involved in like health centers. And I think we're one of the unique spaces that we hold that. And again, there's a really high burden of chronic diseases due to poor health and poor diet. So there is like high cost of this diet and disease related correlations, and there's like about 318 annual cost per patient through the Medicaid, and then almost $500 per patient in the Medicare. And however, like economic status does play a part in a higher burden of this correlation, because families with low incomes do experience higher chronic diseases and mental illness and food insecurity. And I think this space also really tries to focus on that food insecurity part, and we'll talk about a little bit more how the clinic offers more opportunities to combat food insecurity.
Okay. Next slide.
And then also food in general connects people to each other, to the earth, and to culture and traditions. We've held Dia de los Muertos event at our community garden, and that's a picture of 2 years ago. And we hosted our Dia de los Muertos event this past October. And this is just a community event where we celebrate traditional cultures in remembering the people that have passed. And then we also have live music, especially this past Dia de los Muertos, we did have indigenous traditional music and Aztec dancing. And we do hold it at the garden. So it's really, the garden really offers a safe space in order for community members to come and enjoy the event and each other, connect with each other, and also have like an introduction to the garden. And then also food helps to like the action of growing and preparing food. It's really therapeutic and it's stress relieving. So hopefully the intention is to provide that opportunity for patients to get their hands on the food, growing food, and with the cooking classes, actually physically cooking along with each other. And it's just like a really holistic way to incorporate food and the growing food in the clinical space. You're muted, Edye.
Sorry about that. The concept of a federally qualified health center, you want to raise a hand if you've heard that term before, or community health center? Is that a concept or an entity you've interacted with before? All right, thanks, Cheryl.
Yes.
It's I have a link here to a video that I think is great. It's a more than 50-year-old video explaining some of the background and origin of some of the first health centers that were set up in rural Mississippi, I believe. I am actually not sure, a southern state. And they were really intended to be they were modeled after what an individual named Jack Geiger had seen in South Africa, in apartheid South Africa, where health centers were providing more than just healthcare. They were also providing the means and the support for all the things that were contributing to poor health. Like now within our healthcare world, we call it the social determinants of health. These root causes of poor health, like poverty primarily, and lack of connection to resources. So out of that original work, we have a system in our country that supports federally qualified health centers, which really just means a payment designation. And in our state of California, approximately one in five Californians receives their health care at a community health center. Most of those patients are participating in Medi-Cal, or what, in California, our word for Medicaid. And another portion are what we call self-pay. And in many cases, those self-pay patients are not eligible for a federal insurance program, often because of immigration status. Not always in any means, but that's often the case. So we have a little overview of what we do at CommuniCare. We have 3 health centers in Yolo County, one in West Sacramento, one in Woodland, and one in Davis. And last year in 2020, so these we work on a July to June year. We had 22,000 people visit our clinics. Prior to COVID, we were a little over 25,000. So in Yolo County, that's approximately 1 in 9 people in the county that's come into CommuniCare for their healthcare services. And it's a comprehensive healthcare that they get. So our organization in particular has a really robust behavioral health department. And then we have primary care services, all outpatient. All right. Brian, do you want to take it away and talk about this?
So we are all familiar with our traditional clinical spaces that we visit. showing an exam room here and a group visit space. And while these are necessary realities, you know, for sterile healthcare, we see the garden as an opportunity to expand, expand the clinical space. We are. Here's a picture of a nice garden with a labyrinth, a walking path, and a cooking class. Well, this is what we are developing here at CommuniCare. We have a formal garden, food producing, and also an outdoor classroom. It'll be a 3 to 4 season outdoor classroom with shade and kind of light rain production, so that we can have classes, group visits, any kind of presentation that we can develop to help our patients and our clients. And we'll talk more about the food classes as well, but even food classes will take part outside in the garden as well, as as conditions allow. With our pandemic conditions, we're slowly moving in that direction. So
yeah, so I think you probably already picked up on most of what our vision is, but I'm just going to be really explicit and state it here. We are working to connect our CommuniCare community, and when we talk about community, we're really thinking broadly about the patients and clients that are coming to CommuniCare for healthcare services, the staff that are providing those services, and then also neighbors. So the people living across the street from the garden, we want them to also feel welcome in the garden. And we have had some success with people stopping by and also becoming regular volunteers who aren't otherwise connected to CommuniCare. And we have 2 ways of doing that. One is kind of more formal and through these health and more quantitative efforts, I would say, to provide food, to provide education, to eventually, we hope, have those efforts achieve some reduction in chronic disease. But then there's also this like soft science part of it, where we really want this to be a place and activities that bring people together and reduce some of that social isolation and build community resilience. So we have 3 main buckets that we kind of put our work into, or that we use to conceptualize what we're doing. The first is this garden and outdoor classroom that we talked about. Currently, we only have 1. We'll talk a little bit more about future plans. It's adjacent to our clinic in Woodland. And we also have our culinary education that Marina leads. It's primarily cooking classes. We'll talk about that a little later. And then we have our bucket of produce prescriptions, which is largely on hold right now with COVID. Prior to the pandemic, this was actually how we first started our food as medicine activities, was by distributing produce in the context of our group medical visits for patients with diabetes. And so the picture there is of one of our very involved and committed participants in those group medical visits, picking up her produce. So every time that patients would come in for a group medical visit, they would get a bag of produce. They would also be able to take a bite of a snack that we prepared using that produce. So there was a food demonstration component, and then there would be nutrition and cooking information they could take along with it. And then we piloted, in collaboration with a local organic farm, an urban farm, we piloted a home delivery project for patients with gestational diabetes, but we weren't able to secure funding to expand or extend that. So maybe at some point we'll be able to do more of that work.
Hey, Edye, I just want to highlight, I would love to see that proposal and stuff to kind of try and build on that as well. So we can talk more about it, but I think it's just important to highlight, sometimes we submit grants and they don't get funded, and sometimes we don't look at them again, and there's often so much useful stuff there. So It's amazing what you all are doing.
So Susanna, I saw joined, and she's been our partner the past 2 times we've submitted this proposal, and I'm just really tired right now and don't know that I have the energy to do it again this year, but there is federal funding for produce prescriptions. It's just, yeah, I feel like we're at a place right now where we're trying to identify what's best in our situation. And although this is an area that the government is investing in and that a lot of people are putting a lot of energy into, I sometimes sit back and wonder if it's actually going to be the most effective way. I feel like our effort to kind of create an environment that is more comprehensive than just this really like contractual prescription idea might have more promise than the prescription idea, but that's a little tangent.
No, it's good. I think those are the good, those are good discussions to have is what, and a lot of these efforts have been tried before, right? So you can look back and see what's more successful and then adapt it to kind of what's going on right now. It's also a bit different, right? The dynamics and the need for more social spaces is probably more, important now than ever.
It really is. In Los Angeles, we have a good relationship with our network of FQHCs. They actually have a coalition of them. And there may be about 11 centers. And of those 11 centers, there's probably about 30 sites because some of the FQHCs have multiple sites on school campuses as well. So Edye, I would love to invite you and your team. I think Dr. Carey is right. We could brainstorm around how could we work closer with you coming up this year to try to go after other funds. I think the LA Coalition would love to have this presentation. So I'll talk with you more about having you do this again. And there's a lot of local funders here that would probably be interested in piloting and using this to kind of, boost and get your best practices, your suggestions, your data out there to other communities that could, begin to replicate and test and innovate. So I think it's really exciting. This delivery of the fresh food is really a LA thing. Like I could just see LA, the investors I know, like, y'all know y'all want to fund this, so that's pretty cool. I just love it with the FQHC because we love our FQHCs. They're like our beloved health system in LA, so pretty cool.
Thanks, Cheryl. That's like so exciting and affirming. So Brian, you want to talk a little more about the garden? Uh-oh, Brian, you're muted. If you were talking. So Brian's actually in our shared clinical space right now. Masked.
Sorry that happened. So we are extremely fortunate to have a site right next to our clinic. And it's within sight. We're actually, we're getting a new sign made that will increase visibility so folks know that it's kind of behind the clinic. So we're trying to draw more attention to the garden so they see that it's there. And so we are producing food. I generally harvest and bag mixed produce every day. And it gets put in, right now it just gets put primarily in the waiting room. So folks come in for an appointment and they can just take as much as they need, a bag, 2 bags. There's no limit, and folks are, very respectful, and they take what they need at the time. So we're providing fruits, vegetables, herbs, tea herbs, it varies day to day, whatever's ready. Sort of like a mini CSA model where they're just getting, instead of a box, they're getting just a bag, which, maybe is enough for a meal or a little more, a meal and a half or something. And so in addition to the food production, this is a space, we're trying to make it welcoming, a natural space with living things where lots going on, where people can just take a break. Patients or staff are welcome in the garden anytime during the day. And we're hoping that over time, as things grow in, the trees grow in, we'll have the shade structure, bench areas for actual like behavioral health appointments, hopefully taking part in the garden, group visits taking part in the garden. And we're hoping that, what we're setting up here will have a greater effect on just overall health, both physical and mental health issues that our patients and clients are dealing with. In our produce distribution, like I mentioned, right now it's happening mostly in the lobby. This shows kind of a progression. In 2020, we were building the garden right when COVID hit. So we kind of paused construction, or I did construction as I grew food. The first thing we did was just put it in a cooler. And then we kind of grew over time. We set up a table with got some baskets, created sort of almost a mini farmer's market sort of table to draw people's attention to the produce, present it in a nice way. The last photo shows kind of a progression. There's more variety. This is showing mixed vegetable bags. We have a description, kind of Spanish English translation of what's in the bag. Some mixed herb, tea herb bags, which are very popular. Some explanations of, so that's in the photo, there's a red Malabar, which is a type of spinach, which is unusual to most people, but it's highly nutritious. I can grow it in the summer. And so we are introducing new foods to folks as well. And we try to give information and education, what it is, how to use it. So, this expands. And then in addition, we of course will produce food for our classes, our cooking classes. So that's another way that we provide food to class participants. And the next phase that we're working on right now is how to collect data. We want to know what people think about the food, if they like it, they like what they'd like to see different, and then eventually try to tell if this is helping, how this is helping folks in their healthcare, how it's affecting their lives directly. That's what we're working on next, is to how to show that, quantify that, and show the effects that the garden is having on our client base.
Okay, so for my part, I do like the culinary education or like the food education, and whether it's through the cooking classes or through the produce distribution, we have reached about like 4,000 participants that have received either the produce, nutrition, or cooking information, and about 58 individuals have attended synchronous cooking classes. And like Brian said, we do try to introduce different types of produce. So we have introduced about 35 different produce. And we also try to train our staff or volunteers in order to demonstrate the cooking classes. So prior to me, we have, like you saw in the video, we do have sometimes different cooking instructors, either volunteers or part of the CommuniCare staff. And within our 3 clinics, the Woodland, Sacramento, and Davis, each site does have their designated cooking supplies. So if we need to do a food demonstration or a cooking class on site, we do have designated materials and to be ready for that. And then we do use the Cooking Matters program, which is an evidence-based program that offers the training and cooking curriculum and technical assistance. And the recipes that they offer are really, they're like healthy and affordable and tasty recipes that a lot of the patients have enjoyed. And they also offer a lot of educational materials on food labels, on portions, or a lot of really good evidence-based material that we try to share with our patients. Okay.
James Brady posted a question in the chat. Oh, looks like Edye responded.
Yeah, thank you for that. And another way that we try to engage staff is by doing taste tests just for them. So in the past, we have done a moringa and hummus taste test in the garden at the lunch hour for our staff, so they could try to get a firsthand experience of what a patient could experience in a cooking class. So we try to involve the staff in order for them to also promote our food programs to the patients, because they have the appointments directly with them. We don't directly see patients. So it's a great opportunity for staff to be aware, for staff to know what it's like to be in a taste test, to try new things. And we provided, with the help of Carrie, a lot of like moringa education. And then we also have the moringa bed. So we use fresh leaves in the taste test as well. And with the help of Carrie as well, we offer the moringa powders, and that's what I used on the hummus. And we'd play around trying to use different doses to see if people would recognize the differences. So we really try to, we really want to do this like monthly so staff can be aware and like share this information with patients. Yeah.
Marina, can you also mention that we did do a really brief survey there that I really liked. It was short and simple, or maybe Edye, it was kind of, if I remember it, it was just, like I tried something new. I like this, I would like more information. It was about 5 questions and they were, 3 to 5 words each. And just that was also something that maybe we can pull up and share, because I think a lot of people have survey fatigue, and a lot of the monitoring and evaluation of these programs involves surveys. So one of the arts, I think, is to not, to let people fill out a survey pretty quickly where you can get that information out. So I really appreciated that. And I'll also say that the hummus was incredible. And I brought some extra home and had another friend taste it, and she said it was one of the best things she'd had. So I don't think it was just the moringa. I think it was your cooking as well. So having a good chef is also important at these events.
Yeah,
Thank you, Carrie.
Could I ask a question, Marina, while you're talking? Too?
Yeah.
So you're making me think about our community and global food justice workers and different types of educators and chefs. And what I'm thinking about is how do we, Dr. Carrie and Edye, inspire and educate them to really make the connection between what they do and having data monitoring and evaluation. I think many of them may still be struggling with, I'm doing my part, but still trying to figure out what is the benefit of having this academic mentorship and a space like this where they can share and really think through, is your food justice program having a measurable impact? Like, that's what I'm hoping that we're able to capture some of what's working about that. How do we get someone to just go from doing what they do to also connecting it to having this more global, system impact? So I think the surveys people are getting fatigue of that, but maybe we need to do some kind of session like this with just the food justice leaders to help them understand, why is this important to them? What is the benefit of having a process in place that helps them to better understand, why do people like your meal prep plan? Why do people like your recipes? Why do people like the way that you do your farming or some of your specialty crops or whatever? So it just made me think of that I think that's where the next steps go from here. And I like the way you've laid it out, because it's very easy to understand what you're doing and how you're making it relevant, kind of giving them the why beyond their own passion to want to see a healthier community, a healthier neighborhood. So
yeah.
Good job, Dr. Edye.
Yeah, thank you, Cheryl. And I think also even just this presentation in itself is an amazing outcome, or something that I think we should all strive to have, with whether we're an academic or with a project nowadays. It is great to have a slide deck with pictures and bulleted points. And this is very clear. You know, I had already wrote down, like, what are you guys doing for monitoring and evaluation? And then you already have a slide here that has it bulleted, right? So I think this is also just a really good example of how to consolidate it and present it. And it can then stimulate questions as well.
Yeah, we are recycling. So apologies that we didn't just create this from scratch, but we had the chance to present to a group called the Alliance for, you know what, I'm blanking on what it's called, Alliance for Food
Hunger
Security or
free
something.
service?
It was the Hunger Free Community conference, and so we were really excited to have a chance to share this with a larger audience then, and we kind of tweaked it to make it a little more relevant to this group. But yeah, it's nice to have, you know, to put that time in and have something that you can continue to tweak for different events, but not spend so much time on. So, you know, I don't have to spend too much time on this, but in terms of where we hope to go, we would love to get to a place where we can show that what we're doing is having an impact on the outcomes that our organization is really incentivized to achieve. I mean, we have a lot of other aspirations, but in terms of our own survival, we're in a quasi-business setting, you know. Even though CommuniCare is a nonprofit healthcare organization, we are reimbursed for the services we provide, and that's how we're funded. So if we can support our organization gets incentives for doing well on these different, what's called UDS measures, and also quality improvement measures. For example, some of them are the percent of patients with diabetes whose A1C is under 9. So it definitely control. It's a lot less risky than 13, for example. And so there's also things related to counseling people whose BMI is high. And these are not the criteria that we would choose, but because they can result in more funding for our organization, we do want to do what we can to support them. And they're so well aligned with what we're doing. So in addition to that, we're also interested in knowing what the food security status of our population is. We want to improve access to fruits and vegetables. And so those surveys we were talking about, which are really similar to the ones we did with the participants in the food demos with the Moringa. One is we're trying to get information about food access through those. And we currently mostly collect quantitative data on pounds and bags of produce distributed, number of cooking classes, and you've seen all these data that we've kind of included in the previous slides. We have a community compost project of sorts. It's a little bit nascent and kind of a work in progress, but we are trying to track how many pounds primarily staff are bringing to our compost project, and thus ostensibly diverting from the landfill, and then also the number of volunteer hours. We can talk more about that, or come back to it.
I love that part. We have a project in LA again that's really, they struggle with that part of their reporting on the poundage or the number of bags. So I definitely want to, you know, get you connected to this other group to see if we can have more conversations about how you all are doing that, what's working, what's not working.
Sure.
Sounds like a really good discussion and we could benefit from here. I like that part.
So I think Brian's got to take off in a minute, but do you want to quick present this? Oh, okay. I guess he's taken off right now. Just I'll go over. I would say Brian's kind of our primary mentoring lead. Been supporting our engagement with volunteers in the garden. And we also have a collaboration with a alternative high school that's adjacent to our site. So we're really fortunate to have that built-in collaboration there. So it's called Cesar Chavez Community School. We did a collaborative fundraiser to get the garden installed. So that picture there is actually before the site was developed. The tractors had come through and we'd done an original pass on the property. And then the students in their art class created these tiles that people funded kind of as a like fund a brick type of activity. And we used that as a way of getting some of the capital we needed to make progress on the garden. And then we installed the tiles in the garden. They're beautiful. We were so impressed with the students' work. And then the ongoing, I would say our primary source of student engagement has been through the UC Davis Sustainable Ag and Food Systems major. Those students are required to get as many as 300 hours of internship unit hours to graduate. So we're happy to provide them with that opportunity. We've had 6 students collectively contribute 300 hours to date. And then we have community members, one very committed patient who's been volunteering a lot. We also are collaborating with the nutrition department at UC Davis on a food security and healthcare access interview survey. It's an in-depth interview that we will be conducting, that we've started to conduct with patients. We're hoping to engage 40 to 50 individuals. So it'll be more qualitative, but we'll at least have a little more perspective on what people's experience has been during the pandemic and how our food programs can support them better. So I think Brian was going to cover this slide too, right? But I had to take off. So like I mentioned, we do have this community compost activity. And with this new, I'm not sure if any of you have been involved with, it's called SB 1383, a new state law that went into effect at the beginning of this month to require composting and recycling in both residential and commercial spaces. So we're taking advantage of that and trying to leverage it to get people to compost more of their food scraps, get our staff to compost more of their food scraps in our compost. And we are also gonna, I think Marina mentioned that we'll be doing our classes in person. So because we were feeling very burned out on the virtual interface and it seemed like patients were not loving it either and just having a hard time really recruiting people, we are collaborating with our substance use disorder groups that have and continue to meet in person. It's for us a captive audience and, you know, obviously a group of people who can probably really benefit from and enjoy the classes. So we've been doing an aspect of that with a perinatal day treatment program for about 4 or 5 months and are really excited to expand that into our other substance use disorder groups. I feel like we're running short on time to follow up with questions. So I'll maybe just go through these a little faster. Marina, do you want to talk about some of the last things on here, the expansion?
Yeah, and then I just wanted to mention for like the substance use disorder groups, like we're really trying to implement those like in the garden so we can have like the whole experience of even having the patients harvest the foods, getting their hands dirty, and really like promote the space for the garden and for them to experience that opportunity. Because even Brian said before, like he has met people that have never had a fresh produce in a lot of their lifetime. So it's really significant. Like I said earlier too, I had never been like exposed to agriculture like that until now, where I grew up in an agriculture town. But then also we are trying to, I am bilingual, so we are really trying to expand Spanish language classes, especially because our primarily audience is Spanish speaking, and continuing to offer taste tests, food demonstrations in the lobby if COVID permits. And we really, like we said, we only have the garden in one of our clinics, but we are trying to expand, having more gardens or raised beds in our West Sacramento. They're trying to rebuild the playground that there was and install those beds, and then also install an outdoor therapy area in our future admin site in Davis.
Can I, if I could just add in, and I've probably said this in other calls, but there was one study I read that just even having contact with your fingers with dirt, they could see increased serotonin levels. And we've talked about this before, is that, you know, the kind of intervention is not just the food and the nutrition, but the act of gardening, right? And so I think we're all maybe a little serotonin depleted for many reasons. So I just think that it's neat, and these are compelling and ideas, I think, also for proposals that are a little bit of a shift, and I think only come about when you have people working in these integrated teams to look at this. So I'm just, again, really excited and supportive of what you all are doing.
Yeah, and it's, I feel like, especially in today's like food systems, like we don't really, sometimes people don't know where like their food is coming from, or just they don't have, there's no relationship like with earth and food. You just like go to the grocery stores, or if you don't have access to food, like it's a really important component to integrate and promote and share. And again, our clinic has other programs that offer or try to focus on food insecurity and food access, and there is a support group that specializes in doing SNAP outreach and enrollment support. And within the diabetes education appointments, there is the food insecurity screening. And while the diabetes educators do recognize that they might be food insecure, they try to really provide food access, places like the Yellow Food Bank, numbers and dates and information, so they could access those resources. And the Healthy Living with Diabetes program, they do one-on-one patient appointments and do education. And then also the Sweet Success is another program that supports the gestational diabetes patients. And we also have the respite, navigation, and mobile medicine services for populations experiencing homelessness. So there are other efforts besides just the food programs that try to really do this type of like food justice work.
Hey, Edye, I have a question for you.
Yeah.
I was asking earlier about SNAP-Ed.
Okay, right.
And the reason is that back in, it's been some years ago, in 15, I was a recipient of a $25,000 grant from the Sacramento County Health Department to build gardens in the city. In about 18 locations. So they have, I don't know if you could read this or not, but this is kind of what their challenge was. They have a SNAP-Ed target neighborhood. And part of that was to deal with all the issues that you guys are currently engaged in. So I was curious as whether or not, and I think this program was part of CalFresh.
Right, CalFresh. Now they call it CalFresh Healthy Living. So, right, the education wing of it.
Yeah, so they have diabetes, obesity prevalence, environment, physical activity, SNAP-Ed eligible locations. So I was curious as to whether or not your program could actually be a recipient of some of those SNAP dollars to further.
Yeah, so SNAP-Ed is like, I've worked with it for coming up on 20 years now, and it's always evolving. So now, and at this moment, they're not offering any grants, at least in Yolo County, to other projects. like back in the day, 15 years ago, I used to manage what was called the local food and nutrition education channel. We were actually funding nonprofits to do food justice work throughout the state with SNAP-Ed funding, but that is no more. And now we do partner really closely with our collaborator, or like our counterparts at the county who have SNAP-Ed funding. And we're hoping to do a food waste, it's called Food Smarts curriculum, with their educator providing classes to our patients and clients. And then also potentially a trauma-informed nutrition series. So that's how we're working with them right now. And if funding's ever available, we'd love to go for it, but I haven't seen that in the past few years.
Okay.
Yeah, totally relevant, just always shifting, it seems like. So yeah, I feel like we're almost at time, and I want to make sure we have a chance to talk about any other issues that came up. Thank you all so much for your being here, and also comments and suggestions. We really appreciate it.
I have a comment, or maybe I don't know. I accumulated a comment or two listening to your presentation, which I think is very, very good. A few years ago, well, maybe a few years back, I was exposed to a project in India, which it was a for-profit clinic principally for removing cataracts from the Indian population. When they set the program up, it was a clinic, a hospital, a date, where it was funded solely by fee for services. And how it was set up was you could have a Cadillac service, or you could have a Volkswagen service, but it all paid for it all paid the bills and salaries of the staff, so that folks that were well off would pay the Cadillac fee, and folks that had limited resources would pay a minimal fee. And so that, in doing it that way, they were able to keep good quality care for everyone, regardless of what your class or background was. And when I see some of the issues of diabetes and childhood, all the health outcome issues that we see in our communities, some of the mainstream community has those same problems. And when you're trying to do drug reduction, drug abuse reduction, the same thing. So if you could make the services at a highly skilled, desirable level for everybody, and then charge those differentiated fees, that might help with sustainability. We know we can change things through policies like the SNAP programs and other programs, but some of it has to be a standalone. I think that this is an issue of sustainability. How do we sustain the concept, the outcomes, the effective outcomes, and all of those things? If we're monitoring, we find effective outcomes, we don't want that to go to the wayside by who's in office or economic circumstances. We need to find more ways of sustaining effort, and some of those efforts might be on the social investing side of our how we work in this society. So I just thought I'd offer that as a possibility for sustaining effort and it's not a standalone, of course, but all of it works, right? Community agitation, policy changes, but also social investing, I think, should be brought into the picture. So I'll just stop. That's my thought. That's my thought, my collective thought for all I've heard today.
Thank you, Barry. Yeah, Carrie mentioned the concept of sliding scale, and that is the way that we charge for our uninsured patients based on their income situation, their resource situation. I think, you know, what we're challenged with is finding a way to value our value add, like the food piece. So how do we don't want to charge anyone. We want it to become something where people think it's normal to be able to get produce when you come to a doctor's visit, because your healthcare is supposed to support your health, right? But yeah, we have to pay for it at the end of the day. And we've been fortunate to be accessing community benefit funding the past couple of years. And as far as we're aware, we may be able to continue to get that. So that's an outcome of the Affordable Care Act, that healthcare organizations that call themselves nonprofits have to contribute any income to organizations that are addressing the root causes of poor health. But yeah, I think, you know, it's got to be innovative and probably a combination of a lot of different mechanisms for funding.
It does make me wonder. I mean, there are a lot of high-end substance abuse places that people go and pay thousands of dollars. I'm curious if any of them focus on food and gardening, or trauma relief centers where people go. Like, and a lot of, you know, could you get contracted to set up programs where it integrates and there is, you know, other income? Because I agree, like, you know, there are people who are, everyone should have access to this to feel healthy, right? Regardless of income. But I mean, especially the way, you know, substance abuse is now in the country, it's out of hand, and there needs to be more accessible solutions at all levels. So I don't know, it's an interesting idea. I've seen pieces on that, and I don't remember seeing clinics. I just always picture people sitting in a group inside of a building talking, right? That's my classic kind of image of that, not so much in a garden picking vegetables or cooking together. So it's thank you for your thoughts, both of you guys. And the image of, you know, coming out of a doctor's office and going in for whatever kind of treatment and then seeing vegetables as you walk out seems like a really good place and time to present that. I think people have a lot of, you know, a hard time with managing their health. Sometimes they have guilt about it or issues about it. And so when it's right there, it's like this easy go-to solution, or not a solution, but something that can help, you know. And I mean, eating vegetables does automatically make you feel better as well. So I think it's great, and I hope to see more of this happening.
I will just add this whole
really
substance. The substance use piece is really new for us. And in the limited research I've done, I have not been able to find much about other interventions, like other clinics or even recovery places doing nutrition. So there's a ton on the science of how substance use affects nutrition and how important nutrition is in recovery. But if anyone comes across examples or can connect us with somebody that's doing that work to bring nutrition into that recovery experience, we would really be grateful.
And there's a whole agency at NIH just on substance disorders. I mean, there is a lot of funding for, you know, alcohol to all kinds. So, because it's a huge issue, you know, so that would be interesting to expand on. Does anyone else have any other comments or questions? You all did a great job of covering all the questions. I think the only one I guess I would ask was, you know, what challenges are you facing, or kind of what are your New Year's hopes for this year that you come upon, or challenges you hope to overcome? And I think you really talked about everything else, interacting with the community, academia, and industry. I don't know if there's any interaction with industry, but those are kind of the only things I would pull a little more from. But other than that, if anyone else has anything else to.
Marina, you want to touch on challenges or?
Yeah, I think challenges would be just trying to like whether specifically for cooking classes, like how to approach the cooking classes, how to offer them, especially because of COVID, and then how to reach out to patients, have patients engaged. And there has been a lot of like interest if that people want to do cooking classes through our surveys. However, it's a lot of like whether it's technical issues if we do it virtual, or schedules, and my schedule, since I am part-time and I'm also a UC Davis student, and it's just trying to figure out what can best serve the patients and how can they be engaged. And this is why we're trying to now shift into the captive audience of the substance use disorder groups, where we can have a captive audience and then see how that works, whether it's successful, whether it's something that we just want to focus on. But a part of me also wants to continue to offer general cooking classes. So it's also figuring out how the times and like where patients can benefit from that. And just for me, it's just trying to get more information about what the patient needs and being really mindful of the information that we offer. And like, I'm not trying to show up and tell them like, you know, eat like kale when like they don't eat kale, or that like I've never tried kale, or like, or tell them about nutrition when like they're just trying to like have access to food in general. So it's a lot of things that I've been learning to be mindful of that. But as a person like that, I have a clinical nutrition background, education, and a Chicano studies education. I have the privilege to like study these things and look out for answers and be like the person to provide information. I think it's really important for me to really sit with these questions and figure out how can I best provide that information, or even the space. I think with Journey Home, I do implement trying to do nutrition education, but I know sometimes that's not like their main interest, like, but they really enjoy doing like the cooking. But if they enjoy doing the cooking, like that's a win for me. If another thing that Christina, the person involved with the substance use disorder groups mentioned is like being able to take a like time to spend their time into better things than while in recovery. That is helpful. So even coming in with just doing preparing food could be really beneficial to them.
One other thing that Marina and I have talked about and that we would love to expand on, we're actually getting some support from other primary care providers, is a focus on body size. So there's a conference that I participated in, it's called Integrated Medicine for the Underserved, and there was this presentation that just was spot on in terms of this work I had been doing and conversations Marina and I had previously had, but it just consolidated it all. And the title I thought was really appropriate. It was Decolonizing Body Size. And so we're really also trying to approach this from a perspective where we don't, you know, sure, some of these federal mandates are related to BMI, but we want to move away from that. And we want to look at health as a inclusive, holistic thing and not a number on a scale. We really want to move away from the number on a scale. And I feel like personally, I have, it's tough for me to figure out how to do that appropriately as a thin cis white woman.
So Edye, I think I heard you say you guys are working with the nutrition department at UC Davis, and I was curious as whether or not you have access to that curriculum called Teens Can.
I am familiar with it, yeah. So Carrie and I actually met because I was a UC Davis nutrition department employee prior to a couple jobs prior to coming to CommuniCare, but I was on campus for like 7 years. And yeah, I do know that one, but I haven't looked at it for a while. So thanks for that suggestion. I'll go revisit it.
Yeah, they just published it, I think probably about 6 months ago or less.
Oh,
And
really? Okay.
and I'm trying to think of her name, but anyway, it'll come to me. I worked with them for a couple of years. A grad student actually put it together, and it's pretty comprehensive. I think it would be really good for your program.
Okay. Yeah. So industry, I think, was the other question. We would love to create more relationships with industry. It feels like there's so much ag industry in Yolo County. And I think long-term, that would be such a great sustainable way to support our projects, but we haven't really made many inroads. We did at the beginning with a somewhat questionable partner. I mean, in terms of food justice, we were able to get Bayer Crop Science, formerly Monsanto, to do the initial tractor work on the site. And that was so helpful. Their site was only half a mile, or maybe it's like 2 miles. It's really close to our garden site. And so they just carried their tractors over and spent 3 days working up the soil. But it's definitely an area for future expansion. And we do want to be conscious of the food justice component and make sure that our relationships with industry are not undermining larger issues that those industry organizations might be complicit in.
Can I ask too, with the gardening, is there efforts to encourage people to garden at their homes as well? Do you do seed distribution, and is that kind of at that level, or is that part of it?
Yeah, so Brian wants to start a more formal gardening classes this year, but we haven't really moved into that yet. And seed saving would probably be one of the topics we would cover. We would do it in collaboration with the master gardeners. And maybe that will be something we'll do also with the substance use groups. But it's an area where to date, the mentoring has been kind of our way of doing garden education, and we haven't really done anything formal. But the idea is that we would have classes, patients could come, and then we would have an incentive. So it might be seeds, or it might be like we have built into one of the grants we received, we have like grow bags, and we could have them all set up and people could go home with a grow bag with a seedling in it at the end of their class.
Cool. And I'm happy to come back in April or like once the season gets started and do that and distribute the moringa seedlings, yeah, as well. So that would be cool.
I think the one thing we did try out recently that Brian did was the distributing the strawberries. And so I don't remember who donated them to him, but he basically like packed them into little containers and put them in the front of the lobby, like as soon as patients enter. And the person who screens people for like COVID symptoms, they also we told them to help us promote the strawberries, so they take them home. And I also worked on a little flyer of like how to grow strawberries and the spacing that they need and all this information. So that is like one project that we did.
Great. And I just wanted to ask that those who are joining in from other countries. We have a couple of people from Brazil, and my friend Collins Mwenda just joined from Kenya. Could you speak to whether there are these type of clinics in your countries as well, where there's gardens attached to a care facility where people would come and get basic care and Is there any integration of those? I do know for sure there's often school gardens that are attached to schools, but clinics is a more unique thing. So if Raphael, would you want to, or Collins, would you like to comment on that, or Larissa as well?
How are you? Yeah, I'm Collins. For us in Kenya, that for attaching the small gardens in a clinic, that's quite unique. We have the gardens mostly, let's say, in school projects or mostly for even urban settings. But in clinic, that's quite, I think it's quite interesting and unique. Yeah.
Excellent. And thank you, Larissa, for your comment. So it does sound like this is a pretty unique approach and one to highlight. So it's great to see what you're doing. Thank you all so much for your time and putting the presentation together. I think it's helpful and encouraging to follow along.
Thanks so much.
It is, and really inspiring, I think, for our grassroots leaders, like I said, really to help them begin to think through how do we go to the next level. You know, that's what this is really all about. And you see all the components at CommuniCare Health Center, Health Services. You can see all the components interacting, working together. And then I did hear a lot of new innovative ideas. I love the connection with behavioral health programs in an outpatient model, in a residential model, even in a detox intervention, you know, when you're doing that part of the work as well, and possibly prevention. So I think that behavioral health is a great pivot and a natural ally, and there's funding on that side that we could also begin to explore, like how do we bring these two groups together. So I see, plus with the FQHCs and really helping people to see food as a part of the medical visit to help reduce outcomes, you know, raising their awareness while they're already there. It's around all the things that the essential benefits of the ACA is all about, you know, so this is a great bridge, you know, to help make that happen. So I'm so excited once again. It's such an awesome project. I love food justice, if you guys can't tell. And Edye and her team they're the, no, I can't say that on the video. Keenan, make sure you delete that part.
Gotcha.
This was awesome. I'm excited.
Thank you for the opportunity to share.
Can I invite people to come and visit? I've been there several times.
Yeah,
and it's
if you're ever in the area or live close by, we'll definitely jump at the chance to show people around.
Yeah, Christian, maybe we can, since we missed each other yesterday at Davis, maybe we can meet up in Woodland and find a time to link up with. I think even Christian's homeschooling his kids, so every field trip and meeting is also, you know, good for the kids. And so I'm not just thinking about you, but I think your kids would also love to see this garden.
Yeah, I look forward to it.
There's a lot growing there that's not in safe way. Could I put it that way? Or I mean, not in your general kind of US food sections. And maybe Edye or Marina, could you just talk about a couple of the more kind of indigenous foods that you have there? I know he mentioned the red, is it red spinach? But some of the other kind of foods that maybe not everybody knows about.
Sure. So we do have that red Malabar spinach. It was just a random contribution from one staff person. They had this plant that they didn't want to put in the ground. And so Brian put it in the ground last year, and it self-sowed like nothing I've ever seen. So it's a 1/4 acre installation in this garden, and 3/4 of the fence were coated in this vining plant. It's not a true spinach. It's almost like a succulent, and it grows really well in the hot season. So it was great to be able to add that as a green vegetable when there aren't so many green vegetables in the summertime. And then Marina made the most of our nopales
Oh yeah, we also Brian has like one side of the fence filled with nopales, and they have been growing a lot. And I used it twice to do a nopal salad, fresh. And then also Brian tried out doing like the Three Sisters back in October, especially for our Dia de los Muertos event. He had some corn with the beans and squash. So he also really tries to be really mindful of implementing like cultural foods, and I think that's really awesome. And even myself, a lot of the foods that he has grown I've never tried either. So but we try to implement it in dishes, and we have like cilantro, like just a lot of things that patients could really enjoy. And I think we're trying to expand into like more herbs and all of that, and that's another topic.
Mhm. Yeah, so related to kids, Christian, anyone, I did have a picture in that presentation with a friend of mine's homeschool kids coming by for a visit, and the kids love, especially if they're younger, they love the worm bin, and we've got a very active worm bin. We hope to expand that into a larger play area and even a like childcare area where we could have an adult group going on in the shade structure, and then the kids would be supervised and playing kind of off in the corner, but within eyesight, the line of vision.
Yeah, I would love to. I would love to come over and bring the children over there and just let them experience that. I think it'd be a good field trip. Also, I think that the blueprint that you develop would be very good for even the sickle cell community. When you think about, food and medicine and being able to have those type of food demonstrations available, I think that's something that's kind of plagued the sickle cell community, is really just, having all that information and knowledge really stolen from you over time and having to like relearn what it means to like eat healthy. And you're going through contemporary medical institutions where most doctors haven't been trained on nutrition at all. And so being able to have a pathway that somebody who could actually be using food as medicine can come through and have these type of, visits, and then the food be available, not just talked about, but you can actually go home with something. I think that's a very ancient blueprint that needs to be like really brought to, front and center as far as like how, medical institutions can interact with their patients. I think what you're doing is great.
We need to bring it to the Oakland Children's Hospital.
Yeah, for real. And hopefully they'll be open to it.
Yeah.
But I think that's a big deal. When you think about just having those type of food available, because a lot of the times when we have like, we'll have like support groups within the sickle cell community, and people are talking about how expensive eating healthy is. And these are people that actually like really do need to be eating in a way that supports their genetics, but they're having economic issues, social economic issues, as far as being able to maintain, a healthy nutrition plan, whether it be for themselves or for their children. And sometimes, the cheaper food is, readily available and more economic, but as far as how it interacts with our genetics, it doesn't serve as a benefit at all. So I think the blueprint that you have, that you've been developing, is something that's very beneficial. I would definitely want to bring my children there, but I also want to, bring, members from the sickle cell community there as well, so they can be able to see like what is also missing from their hospital visits as well.
Exciting, yeah. Definitely open to it.
Sure.
One thing, Edye, would you mind sending us the link for the opening video so that we could have a chance to try to run it again in case we need it when we do the edits? And we can post it to the website postings and other resources that we're distributing.
Thanks. I hadn't thought about that.
Thank you.
And even I'll go back in the video you said that was, I think, at least 50 years old, about kind of the origins of community healthcare centers, will be interesting to explore as well.
It's really
Yeah.
long.
It's really
So
long.
definitely not a clip, but I mean, it's kind of what I'm immersed in right now, but I thought it was really interesting and also a little depressing because they're doing all this stuff more than 50 years ago that we are looking at now and saying, oh, that would be so cutting edge. I mean, they were hiring ag advisors through the health center because they knew they were working in an ag community and that to increase the economic well-being of the population, they needed to support their ag productivity. So it's like, what have we been doing, wasting time and not moving forward on some of these ideas? But yeah, the blueprint is there. We just need to dust them off, I think.
Does it seem like society wants people to be sick, or am I just tripping?
I just don't get it, because like, how is it in anybody's best interest to have a bunch of sick, poor people, right? Like, even if you're just looking at it from an economic perspective, like, it's not going to make even the top 1% do better if they don't have all those. And that's just looking at our current system. But yeah.
There's no better return on investment, even from a strictly financial standpoint, than investing in health and nutrition, because it's the working capacity and intelligence of society, and so there's really interesting even like numbers on that. This much investment is 10%. You would say that to a stockbroker or a real estate investor, and they would say this is the best investment ever. And yet we still don't do it. So there are certainly counter forces at hand, but yet I think it's critical that we still provide these opportunities and encourage food sovereignty as well. And again, people having, like, this isn't out of reach or somewhere that they have to go, but at their hands. So I think, unless anyone else has anything to say, Cheryl, do you want to close it up for us? Thank you all so much.
Absolutely. Just want to thank the marvelous Edye and her team, Marina and Brian, for coming to share with us the just very innovative and progressive work that they're doing in Yolo County with the CommuniCare health services, and looking forward to sharing this with the rest of you in the world and seeing this thing take off to a whole nother level. And we'll be back here again February the 2nd with another round of academics hard at work to bring this science to the community, and looking forward to people to help us out. Really appreciate it. And we'll see you guys real soon.